And a little bit of chicken fried. Cold beer on a Friday night. A pair of jeans that fit just right.
Okay, today we're going to be placing some implants on the lower right. She has a partial, and that partial includes tooth number 25. So we're going to be bonding a tooth in the number 25 spot, and then we're going to be doing these implants over on the lower right here. We'll talk about that a little bit later, but we're just going to be making a composite tooth. Later on, we'll be cutting this tooth out of her partial and relining it so she can fit it over the implants, but we don't want to do that. Okay, so I start out by making a little composite bridge. Okay, so we built up the tooth to some extent, and now we're going to do a little flowable composite.
I have two.
Okay, so I built up a tooth, and now I'm going to shape it. Okay, so we've prepped our sites, and you can see that this ridge is relatively thin. But we're using a 2.3 millimeter, 2.4 millimeter implant with a 3.5 millimeter restorative interface in this dimension right here. It's thick up here, but then it gets really super thin. And we're going to be able to do this without any bone grafting, which is really nice. Okay, that's our final suturing. We'll take a look at it in a couple weeks. She also had a tooth number 25 as part of the partial, but because we're taking the partial away for the first month, what I did is I just bonded a tooth in there temporarily. And then what I did with the partial was remove that, and we've relined it. Okay, so here's her partial. Number 25 used to be, it's 25, used to be right here, so I cut that off and polished it. And then one of the things you have to be aware of is that these partial dentures have a metal framework, and I had to use a high speed with a diamond and Joe Dandy discs and spend a lot of time getting that metal out of there to accommodate where the healing abutments are. But I got it hollowed out enough, and so she can wear her partial until she gets the implants restored. Looking at the tomograms, you can see that there's plenty of bone height, but we'll look at the mesial marker first. This is the mesial-most marker, and you can see that the bone is pretty thin there. But you know, it would have accommodated another implant, but we're okay with 3 implants and splinting them. And this is the first implant going distal, just distal to the cantilever that we placed. Here's the second implant going distal. And this is the third implant area going distal. And this is where we put the 3.5. So there's the x-ray of our implants, and we're going to take a look at her in a month. She'll be ready to go in another month, a total of 2 months. Okay, this is a 1-month healing of the implants that we placed on the lower right, and this is a 1-year follow-up of the implants on the lower right. 3 splinted implants with a mesial cantilever. And this is about 1 year post-restoration. And taking a look at the bone level, that is looking really good, very stable. These 2 implants are ADI skinnies, and they were placed with the collars supracrestal, and this is a 3.5 Implant Direct Legacy implant. They're all the same matching internal hexes, and the restoration is a splinted 4-unit bridge with a mesial cantilever.
Just right, and the radio up, I like to see sunrise, see you're my precious child, and no mother